To call the meeting of the Rutherford County Benefits and Insurance Committee to order. First order of business, we'd like to recognize a couple of our new members of this committee. First, we have Commissioner Rhonda Allen, and welcome aboard. Thank you very much. One of our other commissioners is very happy you've chosen to accept this assignment. And then we have a new citizen from our public, Mr. Jim Bowles, is on the back row back there next to Mr. Sandvig, that's joining us for the first time. So we're happy to have him. I think he has substantial years of previous service with Nissan in the HR department, et cetera. So he's somewhat semi-retired, I guess, now. All right, thank you. And Mr. Marlin, I think we reappointed you again this go-around, so thank you for serving. All right, you have received a copy of the minutes of the last meeting, and I hope you have read that. Do we have a motion of approval? Ms. Hickerson, and a second from Mr. Nipper and Ms. Boney. Did anyone have any corrections or additions? If not, all of you in favor of that, please say aye. Are there any opposed? Thank you, that carried. Okay, Mrs. Street will now give us an update on our financial condition of our health programs.
Okay. Just for quick reference and information purposes only, this is not included in your packet, but I did pick it up to bring with me. Our fiscal year, we ended at $934 compared to $913 of prior year, which was a 2.3% increase for the fiscal year period. So I'd share that with the Budget and Finance Committee. I wanted to share that with you all as well. I also want to remind you, like I did the other committee, that the period of claims that we use to set rates is different from the period of our fiscal year. So that's why sometimes you see a difference in the number. And medical trend will run you 8 to 10% as well. So those factors go into determination of rates as well as many other things. And I know you're looking forward to that next discussion, and it will be here before we know it. So until then, though, I'll give you the information for the month of July. Our self-funded claims per employee per month ended at $894 compared to same time of prior year of $848. When we combine our on-site medical clinics, our total per employee per month increases to $931 compared to prior year of $853. In Fund 266, which is our on-the-job injury claims, for the month of July, we're at $53,534 compared to prior year of $90,939.
That's the extent of her report. Does anyone have any questions? So we're off to a start that's less than what we had last year.
That's
occurring.
correct.
Is that correct?
Yes, sir, that's correct.
Now, Ms. Allen and Mr. Bowles, if you want to ask any questions or clarification, for example, we're now under an OJI program, on-the-job injury program. It's not the standard statutory workers' compensation program. It basically, she may help me out here, it provides the same benefits except, you know, it's self-managed, you might say. You want to add anything to that, Ms.?
Sure. So it's a self-funded return-to-work-based program that government entities are allowed to participate in. Every 2 years, we run an actuarial study to see what it would have cost us under workers' comp versus OJI. What we're seeing is that our return-to-work days are much quicker, our incidences are down, our lost time is down, and the financials have improved dramatically since going from workers' comp to OJI. Mr. Good, who will be presenting, actually manages that program in my office, and we would more than welcome either one of you all to come. Let us show you the policy, walk through the plan overview, and give you some financial information that we've recently shared with this body. Okay.
And also, Mrs. Street, I think Ms. Allen understands this, but explain a little bit about, in other words, you said we have the basic health care claims and we have the on-site medical. Give Just a brief review of how that on-site medical works.
Okay, so the self-funded claims as reported would be those claims that are filed against the medical insurance, which is administered by Cigna. And then the on-site medical is what we have privately labeled our MedPoint clinics. We have 3 in Rutherford County that employees and their dependents ages 3 and over can utilize at no cost to them. And then we also do generic pharmacy distribution from those clinics as well to accompany any service that is provided. So we're not a dispensing pharmacy, but if you go in, you need sinus medication, something like that, that's generic, we'll probably have that in stock and can provide that to you. We separate out the 2 performances between the self-funded claims and then our per employee per month for our on-site medical. You'll see that for the month of July, we had 1,734 visits to our 3 clinics. We also had 84 retail clinics. Premise Health has a common ownership with the Walgreens company, and we were able to create a relationship with their retail environment that allows employees and their dependents to go to a retail location of Walgreens that has a clinic inside and receive same or similar services at no cost to them as well. We did that because it cost about $250,000 to build a clinic, but it lowered our overhead and expanded our hours for later in the evenings, plus additional weekend coverage, including Sundays. So that's what those costs represent. You can see that the cost per visit at our clinics are $110 for the month of July on average. Our retail cost through a PCP or what we call community provider is running $131.
Okay, so that's a bit of an update. So anytime any of you want to have a little bit of a conversation, I'm sure Mrs. Street would be happy for you to come by or give her a phone call, okay? All right. Thank you very much. And let's see then, do we need a motion on the finance?
No, sir, we don't need a vote.
Okay. Now we'll have Mr. Good tell us about our workers' comp and our OJI statistical information for July.
Good afternoon. Just as a note, I know that you were discussing the financials earlier and you talked about the first month of the year being July. Just to let you know that as far as work-related injuries, we follow OSHA guidelines. OSHA uses the calendar year. So when we talk about OSHA and work-related injuries, we'll be discussing January through December issues and not July through June, just at the point for reference. In the month of July, we had a total of 12 injuries requiring medical attention. As you look at your report there, you can see the breakdown. That brings us to the total for the year of 105 injuries requiring medical attention. Of those, 67 of them are recordable under OSHA guidelines. 30 of them had restricted days, 19 were lost time days, and 18 all others. As you look at the next page of your report, you'll notice that we're comparing this year to the 2 previous years. And out to the right-hand side there, you'll see the numbers. In 2013, at the end of July, we had a total of 96 injuries compared to 2014, 119, and again this year of 105. So that gives you a benchmark of where we stand. The next page, what we report on is the incurred dollars. Incurred dollars are those dollars that we think are expected to close a claim. They are not expended dollars. So when somebody is injured, there's an estimate made on what it will take to close that injury out, and then those dollars are then put into reserve. As treatment progresses on an injury, should that injury take less dollars, then those reserves are reduced, and the money is, of course, put back into the fund. If for some reason additional funds are needed, then the reserves are added. Typically, it takes about a year to get all the bills paid on an individual claim and for those reserves to be settled out. So in the month that you look here at this report, you'll see that February and April, we've had a couple high months this year, mostly accounted to falls and some injuries from that. So we are up as far as incurred dollars. But again, those dollars for this year are still somewhat in flux because we haven't had the time for those dollars to mature. Again, out there on the right-hand side, you'll notice where the dollars were in 2013, 2014, and then again this year in 2015. So what you can take away from that, looking at that, is that we do have a couple of severe injuries this year as compared to where we had in previous years. So we need to work on that. In the month of July, on the next page, you'll see that the total incurred dollars were $13,000 for the 12 injuries. And as you turn the page over, you'll notice the Board of Education had 7 of those injuries that we've been talking about, and the incurred dollars there were $6,300 for the Board of Ed. Also breaks down for you what type of injuries those were. And then the County General had the remaining 5, and the dollars incurred there were $6,700. And then the last page of the report, what we've done is gone back to the Board of Education and broke out where those injuries were. And in the County General, you can see that they were divided up between the Sheriff Department and Paul's Animal Services. Are there any questions?
Okay, any questions for Mr. Good? These on-the-job injuries, on those little boxes to the right of the page, Dan, that's a cumulative data through 7 months, is that correct?
That is correct. Those numbers out there take you through the end of July, so you can compare this July to the July 2 years ago and last year.
We had a couple of months where we really spiked there that's
Yes, sir.
made us put us over the previous 2 years of accumulated costs.
Yes, sir.
Incurred costs.
But the thing to remember is that is this year, so those dollars have not matured yet, so
Right.
they could very well come down. It takes about a year for those to level out, so.
Okay.
Mr. Good, how many open worker comp claims do we have
We
currently?
presently have 11 open workers' comp claims. Now, when I say open workers' comp, those are claims that fall under the old state system, or the state workers' comp system. And we went into the OGI program on January 1st, 2009. So these are claims that are open under the under the Tennessee Workforce Development Program workers' comp. So
So your point of saying that is that those numbers can fluctuate because they can open and close. And 11 is about what we've seen the lowest to be, I know, in the 5 years that I've been in this position.
that is correct. They do fluctuate, simply being somebody who gets injured may be given open lifetime medical, and let's just say it's a knee injury, and lo and behold, you know, we've gone to a certain point, we think that that knee injury is going to be taken care of. There's not going to be any more recurring treatment, and then several years later it comes back, they complain about the knee injury, and because they've got open medical, we send them back to the doctor. The doctor relates their present condition back to the injury, and then we have to reopen it and treat the knee or the injury.
And then just one point of clarification for the committee. He referenced about the OSHA reporting period being on a calendar basis. That's only for the purposes of the report he just provided you. The financials are ran on a fiscal year, so the numbers I'm providing will be on a fiscal year basis for Fund 266.
Okay, are there any further questions for Mr. Good? All right then, thank you very much, sir.
Thank you.
Next on the agenda is a wellness update from Ms. Kelly Perrigan.
Good afternoon. For June and July, the wellness report, the Wellness on Wheels program went to 2 places. We visited the sheriff and the community care center, and we saw 41 people. We also visited the central office and participated in their new hire orientations at the Board of Ed and made contact with 304 new employees. We went to the principals meeting in July. There are 40 principals gathered there, and we did our sign up for this coming year's Wellness on Wheels. And we had the teacher conference this July as well. MedPoint and Cigna saw 267 people at that event. So the total one-on-one contact that we had with county staff for June and July was 652. For the one-on-one coaching in the clinics, the wellness consults for June Patricia Cox had 56 visits. In July, she had 36 for a total of 92 consults. The current and upcoming activities for the fall, our Life Services webinar is Coping with Change on September 15th. You have to register. They're offered at 11 or 1 o'clock, and if you cannot make those two, all the webinars are posted 8 days later. You can view them at any time. We are visiting Blackman High School, Browns Chapel Elementary, Blackman Elementary School, and Cedar Grove Elementary in September for Wellness on Wheels. Our third quarter countywide wellness challenge is Touchdown to True Wellness. It started this Monday and goes through October 2nd. The Alzheimer's Association is having their annual caregiving conference in Nashville on 9/11. Our wellness fair is scheduled for 10/16 at the Community Center at Lane Agri Park on John Rice Boulevard from 3 to 7. When we'll be doing our health screenings and flu shots at the event. And our Know Your Numbers deadline is November 30th. Also, the MedPoint clinics are extending their hours starting September 1st through November 5th. For the biometric screenings, you can walk in, and we are currently working on the flyer. Hope to have that out tomorrow or next week, but the clinics are going to open early from 6 to 7:30. Tuesday, Blackman, Wednesday, Stewart's Creek, and Thursday, Walter Hill, and they'll be available for walk-ins from 6 to 7:30 for the biometric screenings, just as extended hours for convenience of the employees.
Mary, can you explain what you do at the Wellness on Wheels and how many locations you and Patricia go to in a year?
The Wellness on Wheels program is a time where we go visit each county department and each county school. Today, actually, we went to Browns Chapel, and we saw about 30 people there. We do some mini screenings, like we can do a blood pressure check, body fat percentage, body mass index, have a dermascan machine for them to look in, and we talk to them while that they are going through this about the MedPoint clinic, about their insurance, about services that are available, ask if they do go to the clinic, if they utilize it, if they know what they can have done there. We help them with any questions they have about the biometrics or the online health assessments. Just kind of give them an opportunity to have some one-on-one assistance while we are promoting the clinic.
Talk through a little bit more of the Touchdown to True Wellness campaign.
The Touchdown to True Wellness campaign, Patricia Cox wrote this based on the feedback that we had from spring training. In March, we did the spring training, and we had about 200 employees participate. So we did get some feedback that they wished that they had more group activities in the program. So we have written in group activities in this program, but it's a 6-week Healthy Habits Challenge where you and your team photograph yourselves and doing your healthy habits. You send them in and you get points and runs, and there's a scorecard with different activities you can do for touchdowns. The group activities at the kickoff was the pep rally on the square at MTSU, and our end party is going to be tailgating at the homecoming game. So we kind of partnered a little bit with MTSU for this football challenge, and I think that we have about 200 people signed up for this one as well.
The winning team, we've worked with MTSU, will be allowed to run out with the football team at the beginning of the football game as the grand finale. So it's been
It'll be
well
fun.
received. Some of the pictures have been very fun to look at, and I think it's gotten great momentum. They've done a fantastic job developing T-shirts and other pieces of this program.
Other questions for Ms. Perrion? This annual wellness business, I mean, at the Ag Center, Tell us a little bit more. I think you said flu shots, but there are other things you're doing there too. Hundreds of people will show up on that day, will they not, we hope?
Usually we have about 750 to 1,100. We have a little counter that we use at the door, so I'm not, I don't know exactly how accurate it is, but we also do employee registration and we count those as well. So we're pretty close. We've got a pretty good handle. I think last year we had 786 people come. About half of those people come and get a flu shot at the event. Then we also bring about 10 to 12 different health screenings there. The mobile mammography bus comes. You can get a glucose check, blood pressure check. The Lions Club does the eye tests, and we have hearing tests there. And employees can play screening bingo, and if you get 5 screenings, then you can enter into win goodies. So it's just a time that we usually have but sometime between 60 and 80 vendors there, and it's just a time that the vendors like fitness centers or health coaches can come and network with our employees, and they provide a door prize as their ticket in. So, and then our employees that register for the event get the goods.
Okay, anyone have any further questions? Ms. Harvey?
Yes, just for clarification, when we have this annual wellness at the farmer's market, we're not going to be doing blood work that's required for our Know Your Number screening. Is that correct? It's just going to be flu shots and those screenings that you talked about?
That is my understanding, yes.
Okay. So is there a possibility we could put that when you're sending out some information about Know Your Numbers and when it's due, that's not going to be available? Because I've already heard several teachers say they're planning on going to this to get their blood work done, and I have told them, you need to call and check on that. It's my understanding that's not going to be available.
Did do blood work a couple years ago there, and
And I think
there were
that's
more
why-
people than we could manage.
Right, and I think that's why
the
people
wait
think it's
time
gonna-
got very long. We had a lot of complaints. They've been standing in this line so much longer than they would have if they would have just gone to the clinics. And so we are encouraging and trying to drive them to go into the actual clinic, whether by walk-in of the extended hours, walk-in normal hours, or make an appointment. We do, when we do the marketing, we do list what screenings will be available there. So,
One thing too, Ms. Harvey, is that when we did do it at the health fair, that was when those were on a Saturday, because these are fasting labs. Now it is from 3 to 7 on a Friday evening, so that's one of the reasons why it's prohibited from doing it at that event. So, but we will certainly clarify that in communications and set the proper expectations.
Right.
Yeah.
And I understand that, and that makes perfect sense, but that's the Friday of fall break, I believe, and so, somebody might expect
Sure.
that
After.
to happen, and so, if we could just clarify it, just so people wouldn't get confused.
sure, absolutely.
Okay, all right, thank you. If there's no other questions for Ms. Perry, and thank you for that report. Next on the agenda is a request to bid for dependent and spousal employment verification. Mrs. Street, you can tell us about that.
Okay, so this is actually, we will issue, upon your approval, an RFP for both dependent verification and spouse employment verification. So on the spouse employment verification, this will be the first year with the change in the spousal eligibility rule. We will be using the honor system, self-reporting through the enrollment process as to whether or not a group health plan is available for the spouse. And then next year, we would want to have a more formalized process in place, which is why I'm requesting approval to solicit an RFP for a company that can manage the volume of what this type of verification process would involve. Back in 2010, we did a dependent verification audit, and that would be another part of this RFP as well, and vendors could either quote both or one of those two particular audits. And it's good practice to conduct a full dependent audit every 5 years, has been the recommendation to us and what I've read as a period. Since during the audit, the full audit in 2010, we've been manually managing that internal and risk management ongoing. So when a new dependent is added, either through open enrollment or through a life change or a new hire throughout the year, then we have been collecting that documentation. A dependent audit would require that everyone on the health plan who has a dependent provide proper documentation that they are a eligible dependent. When we conducted this back in 2010, the total cost for the dependent audit was $106,304. The project period lasted 14 weeks. We had 6,116 dependents audited. We had 5760 verified, and 356 were determined ineligible, which was nearly 6%. Now, of that 6%, or the 356 dependents, 273 were children, and 83, or 23%, was spouses. This was prior to ACA. Using the numbers of what our current trend was in 2014 on a average basis of claim dollars incurred per year, if we looked at the numbers identified on the children as an example, 273, $2,162 is what we spend on average in claim dollars for each child on our insurance in a year. That would equate to $590,226 in savings. Now, I don't expect we'll see that many children identified because of the ACA, which allows them to be carried to age 26. However, we did project what the impact would have been if 161 verified dependents were left on the plan. That would have reduced our savings by a little over $400,000 back in 2010, which said there were still some ineligible spouses, children on the plan. For the spouses, we had 83 that were removed from insurance as a result of the audit because they were actually ineligible. Utilizing the per annual claims cost of $4,785 per spouse at 83 spouses, that's $397,155 savings to the plan. So we want everyone that can and is eligible and elects to be on the insurance, but for those who are ineligible, we have a fiduciary responsibility to manage that. So I think that the numbers speak for themselves, and I would like to ask permission to issue an RFP for both dependent and spouse eligibility audit.
Okay, you've heard the request. When would we issue this RFP if we?
We would likely issue it towards the latter part of this year, first part of next year, so that we could have it in place around the summertime to begin the process. And we would want to speak with the vendor in terms of the spouse verification and the dependent verification to see if it's best practice to run that post-open enrollment or pre-open enrollment. And we would see where we would get the best ROI depending on what their response is. There's advantages to both ways.
Okay, Mr. Gammon? Yeah, we need a motion, and then you can have some more discussion. But she wants a motion that would give her the authority to go ahead and issue this RFP at some point as they so elect. So we have a motion to do that for Mr. Gammon. Do we have a second? All right, for Ms. Allen. Now, Mr. Sandvig, did you have questions?
From when we went through the dependent audit before, I'm kind of thinking if possible it would be good for the same, I'm trying to think of convenience of our employees, because it was a bit of hassle coming up with the dependent information in some instances. If we could have, having the two together
Be the best?
be the best for verification purposes?
Possibly so. What my research has shown that not all companies that perform dependent verification actually do the spouse employment eligibility verification process. So that's why we would want to issue the RFP in a way, but I agree. We want to pick the best that is meets our needs as well as is financially good for the county and ease of administration.
Other discussion or questions? In other words, we're not setting a date certain, but she'll decide how to do this to make it available before we actually go through before we get to the January 1st rate
Correct.
structure changes of some sort. All right, if there are no other questions, then all of you in favor of allowing us to issue an RFP on this dependent and spousal employment verification, please say aye. Are there any opposed? All right, thank you very much. All right, we're down to any other business. Does anyone have any other business? Mr. Sandvig.
And my apologies, I've been going kind of crazy with school starting. As far as the 1094, 1095C reporting next year, and I won't be here in September, I was wondering if we could have an update on maybe at the October meeting, if you don't, I wouldn't expect you to address it today.
Yeah. I can give just a quick update on that. It will be very short, but we do not have an October meeting because it is our open enrollment period, so our next meeting would be November, and I certainly would have a better update for you then. Just for reference, we did employ SyncStream as the vendor that we are partnering with. Because we have many payrolls to manage, we have to pull from Airport Authority, Community Care, and then the one in the government as well, and Board of Education. We need a central repository solution so that we can pull from our eligibility benefit administration system and these various payrolls into one repository who can then make it meaningful and produce the forms. It's a lot of data that has to be on these forms. So we are working with them to implement the software, and I'll be able to give you a better status on that in November.
All right, so for those of us that don't really know what you're talking about here, Mr. Samuel, does this have something to do with this ACA Cadillac Tax situation whereby we have to determine exactly what our benefits are that we're paying or not?
Now, this is ACA mandatory reporting. This is where we will be reporting whether or not our employee participated in insurance, and if so, if any of their dependents participated, which months within that calendar year each of those individuals in that family participated on our insurance, and provide detail along those lines to the government.
Okay, but there is this tax situation that's looming that we have to make some sort of report at some point.
That's
soon.
2018.
2018, before we have to report that
On the
to see
Cadillac.
if our benefit package exceeds these limits which would place us in a position of being taxed on what we're providing. Is that
That is correct.
okay? I thought it was a little bit earlier than 2018, but anyway, it's coming up on us soon. And what is your take right now? I mean, are our benefits below the thresholds that would impose a tax on us right now or not, or do you know?
Yeah, whenever we had Deloitte conduct a study, an actuarial study of our plans, whenever the ACA was introduced, it showed that we were very favorable, with one exception, which was our option one at that time, which was already over the threshold. And we have since eliminated the $250 deductible plan. There are some narrow margins that we will have to monitor in terms of the cost of those plans as we move through the next 2 years. But we are monitoring that and starting to understand what it looks like since the time Deloitte did that survey to what it looks like now, and what have our costs risen and what portion is the employee paying and so forth.
Okay, well, that's good news. I was just at a meeting that projected over the next 2 or 3 years, maybe as many as 80% of those employees that are providing health insurance will be having to pay a penalty. But it looks like maybe we're going to be in good shape on that, hopefully. Any other business? If not, then we are adjourned. Thank you very much.